Okay, so now I know there's a lot of specifics within your field of sports medicine, but I thought I would ask you about, in general, some of the most common injuries that I see in my office, so that parents can know, when they can treat it at home, when they might need to see a doctor, when they might consider getting the injury imaged.
Absolutely.
So I thought I'd first start with sprained ankles. That's something that I see probably weekly in my office. In
Yeah.
general terms, can you let parents know how to how to manage a sprained ankle from home, and when they might need to talk to a doctor about it?
Yes. So, sprained ankle happens all the time. Running, just twist the ankle. And then a sprain specifically refers to the idea that a ligament was pulled. But if, kid is running, twists their ankle, comes in crying, and ankle swells up, then the thing, a swollen ankle isn't the end of the world. You can definitely start with ice, 20 minutes on, 20 minutes off, if, depending if they're old enough to tolerate that. Usually under 5 or 6, they will not let you put ice on it. But as they get older, they can tolerate those short-term icing. And then, so ice, keeping it elevated, meaning laying down and putting the ankle above the level of the heart so that gravity can kind of pull that down. And then you can wrap it, not too tight. And some patients get a little over vigorous with their wrapping, but wrapping it with like a compression wrap to give a little bit more of that compression and help with swelling. Those are kind of your basic at-home treatments, and you can do Tylenol or Motrin, so acetaminophen, or the non-steroidal anti-inflammatory, so Motrin, ibuprofen, Advil. Any of those are fine. I'd lean towards the non-steroidal anti-inflammatory, so ibuprofen in that family, because that might help with inflammation as well. But you would just want to be cautious that you don't give ibuprofen and then they say, "Oh, I feel great," and now they're running around on a sore ankle. So if you did give medications, they should just kind of lay low for a little bit till we make sure that they're truly feeling better. So then the question comes: so when do you need to go get it checked out? So the big thing would be: are they able to walk normally? If they can walk normally, then they're probably fine to watch at home. If they are walking with a limp or they won't put weight on that ankle, then they should probably be evaluated by a medical provider. That's one of our criteria that we look for to determine whether or not to do an X-ray. So if you're limping or can't bear weight on that on the foot, then we probably want to check it out, and likely we'll look at an X-ray to make sure there's not a break. Um, the one thing with kids is that even though sprained ankles are really, really, really common, kids are still more likely to break, to hurt the bone than they are to hurt the ligament, and versus adults that are more likely to hurt a ligament. So we have a lower threshold to look at an X-ray and make sure that we're not missing something there.
So a couple of questions just to touch upon. One is, right after sprained ankle, most kids will limp. So is it more of the length of time after they sprain their ankle that you would get an X-ray or want to be evaluated?
Yes, that's a good question. I mean, the criteria is actually if they're limping at the time of injury or once they come into your office, so into our office. I think sure, if they twist their ankle, they limp for a few minutes and then they're up and running without any medications or other significant interventions. I think you're fine. You're good to go. But if it's going on, hours into days, then that's when you'd want to check it out. If it's stopping them from doing their regular activity, that would be time to check it out as well.
Okay, and just to also touch upon, you mentioned ice. I think that's such a great point about under 5. It might not work out so well. I remember I used to always tell parents, advise them to ice injuries, and then when I had my own kids and they were little, and I tried putting ice on an injury and they wouldn't let me, I thought
Yes.
it's an example of where the advice that's really easy to give but harder to follow. So
Yeah. Yeah, I think those younger kids, they're just not they're gonna be too uncomfortable with it. And even some of the older kids won't tolerate it. But it's worth a try as worth offering it and see what they'll tolerate. So
And specifically, you said to put it on did you say every 20 minutes?
yes. So usually you want at least 20-minute break between icing sessions, and then not to have it on more than 20 minutes. And then when you do have it on, having something between the ice and the skin, so like a thin towel or washcloth, something just so that you're not, I've seen some cases of, frostbite or, skin injury because the ice was on either too long or just too cold against the skin. So we want the cold, but we got to get to that happy medium of having the cold without injuring the skin.
Okay. And out of curiosity, do you think it really makes a difference? Does ice more work to improve symptoms, or does it work to help the ankle feel better, to numb the pain?
So for ankle injuries, I think it is a combination. I think the ice does bring down the pain level, but it also constricts those blood vessels and decreases the swelling that can occur. So I think it definitely plays a role there. In other injuries that may not swell so much, then it probably is less of a role and maybe more pain. But for ankles, it can be really helpful.
That's great. And how long should parents expect to ice the injury for? A day or two?
Yeah, it really depends on the severity of the injury, of how long the ice is needed, and so how much swelling is there. But if there's swelling, then the ice can be helpful. So as long as there's swelling, then it's worth trying some ice to bring that swelling down.
And then while we're on the subject of ice, something that comes up a lot, parents don't know whether to use ice after injuries and when to switch to heating pads and warmth. Do you have any general advice on that principle?
Yeah, I mean, the number one is the medical data. It doesn't, isn't super strong in either direction, except for acute injuries. Ice is more helpful. So again, ice to prevent the swelling or bring down the swelling in an acute injury. So meaning they ran, they twisted their ankle, and now it's sore, or they fell and landed on their knee. Let's put some ice on it that will prevent it from getting too swollen or bruised, hopefully. So those are definitely cases for ice. Things where it's more chronic, like, well, I've had a sore back for a week or so, that's where it's much more mixed, ice versus heat versus a combination of the two. And that's where I recommend just doing what feels better for you. So sometimes in those cases, like a sore back would be, you can do ice after activity or after injury, and then before, if you're trying to kind of warm it up and feel better, then actually doing some heat can be helpful. Sometimes people just like to alternate ice and heat, or ice bugs them a lot and heat feels good, or vice versa. And so for those situations, it's really what feels best. But for the acute injury, a fall, a twisting of an ankle, things like that, ice is the best.
Okay, so right after an injury, ice maybe for the first day or two, and then aside from that, it's more about what feels good.
Exactly.
Okay. Now, this is a complicated subject. I know there's a lot of details and a lot of specifics to get into, but I wanted to briefly touch upon concussions. A lot of kids are now back in sports, and I've seen an uptick in head injuries. And I just wanted to let parents have a general understanding about concussions. My first question to you is, how can parents distinguish between, if their child gets hit on the head, how can they distinguish between a head injury, feeling a headache after just being hit on the head, versus an actual concussion?
It's tough. So in the sense that
it's a loaded question.
Yes, exactly. I mean, concussion is defined as any trauma to the head that is associated with headache, dizziness, nausea, and a whole constellation more of symptoms. So by definition, if someone comes in and says to me or tells me as like a over the phone conversation that yes, their kid got hit in the head and they have a diffuse headache, meaning like it's the whole head. If they have, oh, I bumped my forehead and it hurts right here in that one spot, then sure, that probably is just a bump to the head. But if they have a headache, if they have nausea, if they're kind of feeling tired or a little out of it, dizziness, any of the other symptoms, then it gets called a concussion. And so it's pretty low threshold to call it a concussion. And we don't have a ton of tests to define it better. It's not like it can be like, okay, well, it sounds like a concussion. Let me do an X-ray, and then we can confirm whether it's a concussion or not. It's really, once we hear that history, if there's a trauma and then any of the symptoms that go with concussion, then we call it a concussion. And the part with that, I guess, that's challenging is, then it does change what you're going to do for the next, week or so, in the sense that if it is a concussion, then we don't want a new head injury during the recovery period. And so that, so going back to that, so I'll recap here. So what do you do if your kid gets hit in the head and you're not sure if they have a concussion or not? I think that's the time to call your primary care physician, have the conversation, and then work through whether we need to take further precautions for a concussion, or whether, you know what, maybe this is just a bump on the head. But I think it's a hard decision as a parent to make. But if there are symptoms other than just pain at the spot where they were hit, then we're probably going to lean towards calling it a concussion.
I think this is a great overview, because I think what's so tricky is that there really is no specific test to diagnose a concussion. There's no MRI, there's no X-ray, no CT scan where you can visually see or identify a concussion. It really has to do with a constellation of symptoms, as you described.
Yeah, exactly. And I always like to tell families too that sometimes there'll be a head injury and they will go to an emergency department, and sometimes a CT scan will be done and sometimes it won't. It's not done unless the medical staff is really concerned that there's a bleed in the brain or a skull fracture, something more serious. And that's because if we can avoid a CT scan, that's great, because it's a bunch of x-rays to the head. With that said, if there is concern that there's something more going on, then that CT scan is worth every bit of exposure. And then sometimes it comes back normal. So when the CT scan is normal, families sometimes come out thinking, oh, it's okay, there was no concussion. But the definition of concussion is any sort of head injury with those symptoms. And by definition, the CT scan would be normal because it's more of a functional problem than a structural problem. So meaning the CT scan looks normal, but it's still, things are still not quite working quite right.
I also find what's interesting with concussions is that kids will have emotional disturbances. They're more sensitive, or their personality might seem different. They're slower to respond to parents. So those are also symptoms to be on the lookout for.
Yes, absolutely. And I think sometimes even it's a little delayed in the sense of what everyone picks up as for the concussion, meaning that maybe they played in a soccer tournament on Sunday, it was a hot day, and so there were lots of bumps during the game. There wasn't any one specific one, but end of the game, they've got a headache, they're tired, and everyone's like, oh, it was a hot day, they're dehydrated, it was a long day, they're tired. And so no one quite puts it all together just yet. And then they go to school Monday. Now they're having some difficulty concentrating, or they take a test that they perform much more poorly than usual. And so then in hindsight, we go, well, wait, was there something more that happened? Maybe they're more sensitive at home. They're crying out of character. And those can all be signs that a concussion had occurred.
And in general, I know this is a very complicated topic and there's a lot to discuss. But what would the recovery in general look like for families? What could they expect? Is a child going to stay home until the symptoms completely resolve, or will they anticipate going back to school shortly after?
Yeah, good question. And this has changed a lot over the past really 5 to 10 years. So it used to be if you were diagnosed with a concussion, you were told, go in a dark room and don't come out until you're better.
Right.
That's absolutely fallen by the wayside. Research has shown us that sitting in that dark room makes you more anxious and worried about your symptoms and feel more symptoms and makes the symptoms last longer. So what we want to do is very individualized, because we need to support the symptoms that they're experiencing and try not to aggravate them, but really encourage them to engage in as much of life that's not too stimulating. So some of the example I put it would be with school. So again, they looked at staying home from school for 5 days versus going to school when you feel like you could. And the kids who started to go when they felt like they could actually recovered faster. So gradually getting back into school, maybe you don't go a full day right after your concussion, but for a couple hours, if that feels good, slowly increasing that, and still engaging in social interaction with friends is important. Doing calm things like listening to music, listening to podcasts, watching television is okay, but avoiding things like video games, lots of computer time, big events like concerts with lots of stimulating components. So it's finding the balance between all of that, and it is a longer discussion, but those are some of the key points of it.
So it sounds like in general, it's more about monitoring their symptoms and gradually increasing what they do based on what they can tolerate.
Exactly. Yes, that's perfect summary, and that happens anywhere from a few days to a few weeks time. So when parents are wondering, well, how long is it going to take to see this recovery? 70% of kids are 100% by 3 weeks. Many are better faster than that, and then there's still that little component that takes longer, and we just need to treat each child individually depending on their symptoms and supporting that.
Now, I know we talked about going back to school, but what about participating in sports again? Do they have to be fully recovered from symptoms?
So to return to sports, there's also a gradual return, and this is actually a very specific day-by-day advancement that you would go through, and you need to complete each step before you go to the next. But we encourage early activities, so starting with walking, some stretching, some things to get the heart rate up, as soon as they can tolerate. And so that's like 10 to 15 minutes on the first day. If that feels good, meaning their symptoms are not worse, they can do 20 or 30 minutes on the second day, 30 to 45 minutes on the third day, and then move up to non-contact training. So non-contact training can look like, yeah, you know what, they still have some symptoms, but when they play, when they go kick the ball around or go for a run, they feel good. So they're allowed to be out there, but not doing drills where they're playing defense or someone playing defense on them or having anything coming at them. So for baseball, for example, that they can go out and hit off a tee, they can throw, they can run, but they shouldn't be fielding or hitting a pitched ball. And then they sit at this level of kind of non-contact until they are symptom-free. So once their symptoms have completely resolved, the criteria to go back to full play is symptoms have completely resolved, they're back to full school and normal academic performance, and they've done this non-contact level of training and have felt good without symptoms. Then they'll usually see their medical provider who can then say, all right, now you're cleared, but they still need to complete a contact practice before they go to a game. So as I always tell patients when they come in for their visit, don't come to me on game day for your follow-up. Please come so that we can make sure to get that contact practice in before the game.
So it really sounds like recovery from concussions and returning to sports is a very individualized approach.
100%. That's the key word at this point, is individualized return to play. And so, like I said, some kids do that progression over a 7-day period and they're good to go and they're back to their full sport. And other kids, they might, kind of sit at one of those levels for a few days to weeks, or maybe 2 or 3 days at each level, and they get back there. By definition, concussions resolve. You get back to your full activity. But it just takes different people a different amount of time.
No, thank you for explaining this. I know that this could be a long conversation in and of itself, concussions, but it is an area that as you mentioned, has really changed in how we manage them over the last 5-10 years. Thank you for that overview.
Yes, no, concussion is a very lengthy topic. I could talk to you probably all day about it, but yes, I think those are the key concepts. You get better, and it just takes the amount of time that you need as an individual.
Thank you so much. So now, just to conclude our conversation, is there any advice that you'd give to parents? After all the work and children you've treated in the field of sports medicine, any advice for families? Should they think about sports? Should they avoid sports?
Yeah, I think sports are great. I think they just play such a great role in children's lives, in families' lives. I think they're a great way for kids to be active, be social, build confidence, build strength, stay out of trouble, keep good motivation and direction. So I could go on and on with my list of I think the role of sports, and I think it's just engaging with sports and physical activity in a really healthy way. Making it be fun, finding your passion within, in the sense of there's so many different sports that are out there, from kind of your more common soccer, football, volleyball, to all sorts of new sports that have popped up over the years, from parkour and rock climbing and indoor, outdoor. There's something for everyone, and so I think it's really important to help kids to discover what they love and how they can stay healthy and active.
Thank you so much. That's such good advice.
Yeah, thank you. Thanks so much for having me. It's such a great conversation.